Hi, Jamie Davis here from the Nursing Show. We're here at ANIA, the Nursing Informatics Conference in Philadelphia, and I'm really excited to have Dr. Susan Matney here with me today. And first of all, Dr. Matney, congratulations. I understand that the doctor is relatively recent.
Yeah, last Friday I defended my dissertation. I wrote a theory of wisdom in action for clinical nursing.
That's excellent, and so congratulations from me and all the Nursing Show community. That's really exciting. But we're here talking about nursing informatics, and I'm curious about it because what your topic is, because it's about standardized language and terminology, and you wouldn't think that that would be so much of a problem. I mean, nursing, we use the same language, don't we?
No, nursing doesn't use the same language, and that's the biggest problem. Nurses need shareable, comparable data. And so if you want to look at quality measures across systems, the data should be coded the same. And in our old mainframe systems, when we would start creating a documentation system, we would just put a code in that would be their own code. You know, I need a systolic blood pressure, well, let's put the next code in. And so now what's happening in the United States is they're stating that for observations or nursing assessment measures, the question should be coded with LOINC. So if you have a systolic blood pressure, that is encoded with LOINC. So when I send it to another system, if you're discharged and go to a long-term care facility, I can look and see what their last blood pressure was without having to do translations.
Now I'm going to ask you to stop for a second. LOINC. Can you explain that to me? Because yes, I don't know what that is.
Yes, I can. There's actually 20 terminologies that the United States has mandated for use, but LOINC it started for lab. It's logical observations, identifiers, names, and codes. And it's any type of an observable. So if you can see it, if you can measure it, so all the laboratory measures, assessment measures, skin color, skin turgor, all of those are in LOINC.
Okay.
And the other terminology that's been mandated for use is SNOMED CT. And that has been mandated for meaningful use problem list. And for nursing, we have developed a SNOMED CT problem list that can be downloaded from the National Library of Medicine that can be used to fulfill the meaningful use criteria for problem list using a nursing diagnosis. It's not just a physician that can do that. Now, if we go back to the observations, when you look at a skin color, the skin color question is LOINC. And the answer, ruddy, jaundiced, pink, those are SNOMED codes, so they're married together.
Okay.
The vision is that when we're all using the same language, we can start comparing data across systems and across, you know, the context of the patient. And so the ANA initially started recognizing terminologies in the late 80s, early 90s to be approved within an electronic health record. They had to meet certain criteria, you know, they had to be maintained, they had to be updated and monitored, and there are 12 terminologies that are approved for use in electronic health records by the American Nurses Association. The American Nurses Association is putting out a position statement in the next month that's stating that when you message the data, it needs to be messaged with LOINC and SNOMED, but when you use it inside your system only, you can still use the ANA approved terminologies, which are NANDA, NIC, NOC, Omaha, CCC, LOINC, SNOMED, all of those are ANA recognized terminologies. So we don't want to take those away. Those really matter and have been validated and researched and influence the science of nursing. But we want to be able to talk to each other within systems and among systems and put nursing at the same table as other disciplines and not just use nursing terminologies the other disciplines don't understand. So this will help us be interdisciplinary when it comes to looking at quality measures. We can look at nursing and other disciplines and compare when we say the same language. It's kind of the lingua franca for what we will all use. But in your systems, you can still use the standardized languages that ANA has approved.
So Is this something that's mandated, or is this something that is going to individual nurse informaticists are going to start needing to implement in their facilities and be champions for?
This is something that has come down from the Health IT Standards Committee. They have put out the new interoperability roadmap that says that you need to use these specific terminologies when you send data in a structured document using HL7. Okay. And so that the standardized terminologies that are approved for nursing are LOINC and SNOMED. Now, LOINC and SNOMED are very sparse still in some areas. And so I have a group of experts in the United States that are looking at nursing assessment, and we're creating a minimum nursing assessment with all of the answers encoded with SNOMED and the questions encoded with LOINC, and we'll be submitting that to LOINC. And I'm the chair of the Nursing LOINC Subcommittee. And we've talked to LOINC, and there will be a landing page for nursing where you can go in, and if you're writing a new documentation system and you want to standardize it, then you can say, I'm working on neurologic assessment, and you can pull all of those coded questions and answers down and encode your nursing documentation system using the standards. We have a long ways to go, but I think we are headed in the right direction.
Well, that's important, and I can see the value of it instantly the minute you started talking about it. I mean, we need to be able to talk to each other in ways that we all understand. We can't use one set of terminology in the Midwest and another set of terminology based on where you went to nursing school. It can all be different if you're not careful, and so we need to be careful.
It is all different right now, so we need to go back to where we are the same. And that's hard because there's a lot of good work that's been done, and we don't want to take that away. We just want to enhance that.
Well, I want to thank you very much for coming on the show and checking out and letting me know some of these things that I was not aware of before we sat down. So that's always great. I love learning these things.
Thank you.
And I want to thank you as well for checking out this segment here from ANIA in Philadelphia 2015. I'm Jamie Davis from The Nursing Show. Remember to check back at this channel or over at NursingShow.com for more segments from this Nurse Informatics Conference.